Hi guys, I'm Allie, your nurse, and today I'm going to be walking you through peripheral artery disease with a case study and concept map to go with it. So we have Mrs. Linda Thompson, a 72-year-old retired school teacher. She was referred to the vascular clinic by her PCP due to complaints of severe pain in bilateral lower extremities when walking, which she describes as a cramp-like pain that subsides with rest. After a thorough evaluation, she was diagnosed with PAD. Patient background: she has a medical history of hypertension, hyperlipidemia, DMI 2. Medication she's on is metformin, atorvastatin, and lisinopril. She has a social history, non-smoker, lives with husband, relatively sedentary lifestyle. Family history: father had CAD, mother had a CVA. Signs leading to diagnosis: increasing leg pain when walking, which resolves with rest, cold feet, noticeable decrease in leg hair growth. Her vital signs: blood pressure 142/90, pulse 78, respirations 18, temp 97.6, and oxygen 96 on room air. BMI of 30. Head to toe assessment was diminished pulses bilaterally in her feet. Capillary refill in toes greater than 3 seconds. No visible wounds or ulcers, but feet cool to touch. Some diagnostic tests they did on her is an ankle brachial index, ABI, and the results of that was a 0.65 on the right and 0.70 on the left. A normal is a 0.9. So anything less than 0.9 is considered abnormal, and that was confirming PAD. A Doppler ultrasound also showed significant atherosclerosis blockages in both femoral arteries. So I made you this concept map, and it describes the signs and symptoms. Some of those I got was increasing leg pain when walking that resolves with rest, also known as intermittent claudication, which she had that. Cold feet, had that. Diminished or absent bilateral pedal pulses, and that was also another problem. Loss of hair growth on legs, yes. Skin changes, cramping of the arms or legs when in use, and she had that as well. The pathology of peripheral arterial disease is a condition that is caused by narrowed arteries and reduces blood flow to the extremities. Arteries narrowed by plaque and other fats and cholesterol cause a blockage that reduces the blood flow. Some risk factors include smoking, age 65 and over, and she's 72, high blood pressure and cholesterol, which she has hypertension and hyperlipidemia, diabetes, which she's on metformin, obesity, BMI over 30, she has that, family history of heart disease or stroke, her mother had a CVA, and unknowingly to some stress. Stress causes the arteries to narrow and tighten. Then we have some treatment medications. It depends on the severity. Treatment can range from dietary and lifestyle changes to medication and or surgery. Statins such as atorvastatin and rosuvastatin are the drug of choice for PAD to lower LDL and diminish fat buildup in the arteries and help prevent MIs and strokes. Antiplatelets such as clopidogrel and aspirin to prevent blood clots, and RAS inhibitors for the cardiovascular part of it. Some lab and diagnostic tests we would take is CBC, BUN, and creatinine, electrolyte levels, lipid profile, coagulation test, PT, APTT, and a TT. And obviously the ABI test, which for that, it's the first used test to diagnose PAD. It's non-invasive and painless. So she had an abnormal ratio, but anything less than 0.5 would indicate severe PAD, which she didn't have severe PAD, just abnormal. Doppler ultrasound to assess blood flow status, which they did that as well, and it showed that blockage. Potential MRI, CT, MRA. For a nursing diagnosis, we would put ineffective tissue perfusion related to atherosclerosis, plaque buildup, and reduced blood flow, as evidenced by weak peripheral pulses and intermittent claudication. Client will achieve adequate tissue perfusion with +3 peripheral pulses. And client, I hope I did that right. Client will verbalize their lifestyle modifications to decrease weight. So that's what we want. We want her to have some physical activity, work out a little bit, and start moving more because she's living that sedentary lifestyle right now. Patient teaching would be smoking cessation if smoker due to worsening signs and symptoms and further damage to arteries. Dietary changes, low in fats, added sugars, and red meats. Limit sodium in canned foods. Exercise routine. Manages risk factors, improve circulations, and then avoid alcohol. Other nursing implications is blood glucose monitoring and regulation, proper foot care, refer to dietary nutritionists, manage comorbidities such as her high blood pressure, and prevent further disease progression as well. Some other things we could promote is elevation of legs above the heart, so that way it can break up that blood flow that's stuck and blocked down there. And then heat therapy also helps. Could be warm compress, or soaking her feet in the bath, hot and warm water. And that's all for now. Like I said, this is the concept map, which I will share with you guys, and my references. And yep, that's it. Thank you.